Hi everyone, so today we're doing anterior triangle of the neck. Anterior triangle of the neck is visible in the lateral view of the neck. Here you can see this is the sternocleidomastoid. It gives us two triangles, and the posterior to sternocleidomastoid is posterior triangle of the neck that we've already discussed, and anterior to the sternocleidomastoid is the anterior triangle of the neck. Anterior triangle of the neck is further divided into multiple triangles, and as I've already told you, posterior triangle is divided into two parts as well. One is the occipital part, which is above the inferior belly of the omohyoid. Bear in mind, this is the inferior belly. And below the inferior belly of omohyoid muscle, we have our subclavian part. So those were the two parts of the posterior triangle of the neck. Whereas the interior triangle of the neck, it's divided into four parts. One is the submental triangle right below the mentis, or yes, right here. And then you have the submandibular triangle, also known as the digastric triangle. Then you have your carotid triangle, which is the most important triangle here, and then you have the muscular triangle, which is enclosed by the muscle. So these are the four triangles, right? So let's start off first of all with the boundaries of interior triangle of the neck. For that, we'll be referring to this book called BD. Right, so here we can start off. It says that anterior triangle of the neck lies between the midline of the neck. It lies between the midline of the neck and sternocleidomastoid. It is subdivided into smaller triangles. So it lies between the midline of the neck and the sternocleidomastoid. What is the midline? This is the midline and the sternocleidomastoid, right? So this is where it lies. Now you do not need to know the surface landmarks. Let's move forward. Structures in the anterior median region of the neck. Let's not even go in detail of that. Yes, anterior triangle. The boundaries of the anterior triangle of the neck are anterior median plane of the neck. That is medially. So medially, you will have anterior median plane of the neck. Laterally, you will have the sternocleidomastoid, and the base is formed by an imaginary line that connects the mastoid process to the angle of the mandible. So this is the mandible and angle of the mandible. So there is an imaginary line. So that's the base. So this is sternocleidomastoid laterally. Medially, you have the median plane of the neck, and then you have the imaginary line as the base. So this is your interior triangle all in all, right? Now moving forward, it is subdivided into submental, digastric, carotid, muscular. Digastric is also known as submandibular, right? So submental and submandibular, do not forget them. And this division is made by digastric and the superior belly of omohyoid. So that's something you shouldn't forget. Digastric muscle and superior belly of omohyoid. So let's clear that confusion as well. Here you can see this is the omohyoid muscle. So this is the superior belly of omohyoid muscle, and this is the inferior belly of the omohyoid muscle, right? And in the middle, this is joined together by intermediate tendon that basically holds this muscle to the clavicle and first rib by the fascial sling. So it is held to the clavicle and the first rib. Here you can see the digastric muscle. It has an interior belly and a posterior belly. This is again held in the middle by an intermediate tendon, which is held to the hyoid bone by the fascial sling, right? Now, this entire division is caused by the digastric muscle and the omohyoid muscle. So digastric muscle makes this division, and the superior belly of omohyoid muscle, because inferior is in the posterior triangle. So that's two things you need to know. That's the reason there are all these divisions. See, one triangle is here, one triangle is here. One is the muscular triangle, one is the carotid triangle. Right now, you may be getting very confused that they're not very defined, but trust me, they're pretty much defined. If you want a clear image, you can see this, or you can also refer to this diagram right here, which I took from another YouTuber, or you can say the study channel. And yeah, so let's talk about this. This is your digastric, right? Also known as submandibular. This is where your submental lies. This is your carotid, and this is your muscular, which is enclosed by the muscles. Okay, so that's how you'll have a clear image. Because when you study about the anatomy in a proper format, you'll understand it better. So this is submental, this is submandibular, and then you'll be able to see the carotid and muscular, right? And okay, moving forward. So this is important that superior belly and digastric makes all these divisions. Now, when you talk about a submental triangle, this is a median triangle. It is bounded on each side. There's anterior belly of the corresponding digastric muscle. Its base is formed by the body of the hyoid, and its apex lies at the chin. I hope you're able to format this. So what are we talking about? Submental triangle, right? So submental, I've already told you, it is right here. This is the submental. So its base is supposed to be formed by the hyoid bone, and it's what do you call it? Its apex is the chin, and on the both sides you'll have the interior belly of digastric. If you can recall, this is the interior belly of the digastric. Remember, this is the interior belly of the digastric. So basically, this triangle lies on the both sides. So in this diagram, you can see the gastric anterior belly, and then there'll be the posterior belly. Here is the hyoid bone. You can see this is a hyoid bone, and then chin. So this is the submental triangle, right? So these are the boundaries which are very well defined. The floor of the triangle is formed by the right and left mylohyoid muscles and the median raphe uniting them. So this is the median raphe that is uniting them, and this is the mylohyoid muscle. So right and left mylohyoid muscle, because this is basically a median triangle structured. So this is structured in the median plane, right? So you'll have the this raphe, which is the median raphe, which is joining them, and then you'll have mylohyoid muscle right and left. So base is the mylohyoid muscle. I hope that's clear. So when you touch your neck, and if you feel like your double chin is it's bulging out, so that's your mylohyoid muscle. Okay, I hope now it's clear. Mylohyoid, so it's basically connected to the hyoid bone, right? So this is your submental triangle, and this is the easiest. Now, what are the contents? It has submental lymph nodes. They're situated in the superficial fascia between the anterior bellies of the digastric muscle. So anterior bellies of the digastric muscle, between them in the superficial fascia, you'll have the lymph nodes. Then moving forward, we have what? What is the next thing? We have our what's the next content? A superficial tissue below the chin, central part of the lower lip, the adjoining gums, anterior part of the floor of the mouth. The efferents pass to the submandibular nodes. You also have submandibular nodes. Submental veins join to form the interior jugular veins. So here you can just know the lymph nodes, so that's enough. And further, submental veins join to form the interior jugular vein. What does this mean? So interior jugular vein is formed by the small submental veins. Interior jugular vein is formed by small submental veins. Let me see here if there's any diagram here of that. This is something you need to know. Interior jugular vein, it's formed by submental veins. Right, it's not mentioned here, but this diagram will help you. So these are the submental veins, and they join together to form interior jugular vein. So that's how you need to know. So this is the submental, right? So you have interior belly of the digastric, hyoid bone, and then you apex is formed by the chin. And this is the median raphe, and this is the mylohyoid muscle, and there are submental veins that come together to form interior jugular veins. So interior jugular vein and submental veins, right? And these are the submental lymph nodes. So these are two things you need to know. Interior jugular vein, which is united by the submental veins, right? So submental, everything is submental, and even the lymph nodes are submental. So basic. Done. Moving forward, digastric triangle. The digastric, the submandibular triangle. I can already guess one of the contents by looking at the diagrams that its contents will include the submandibular gland. Let's see if it has submandibular gland. Superficial part of the submandibular salivary gland. Yes, so there we have it. This is my favorite because it has the submandibular gland. It's also known as digastric triangle or submandibular triangle. So right here you can see it. It's so easy and it's so pretty. Let's see, I can see the superficial part of the submandibular gland, and I can already guess that this triangle looks like this, right? So we'll have both the anterior and posterior belly of the digastric muscle, and then the base will have probably the mandible. So let's just look at it. Boundaries of the digastric muscle. The area between the body of the mandible and the hyoid is known as the submandibular region. So between the body and the hyoid, that's the submandibular region. The superficial structures of the region lie in the submental and digastric triangles. The deep structures of the floor of the mouth and root of the tongue will be studied separately. The boundaries of the digastric triangle are as follows. Antero-inferiorly, so antero-inferiorly is the anterior belly of digastric. Posterior-inferiorly is the posterior belly of the digastric. They're also saying there is stylohyoid. So posterior belly of the digastric, I do agree to that. But where is the stylohyoid muscle? So this is very thin stylohyoid. It joins the styloid process. This is the styloid process. This is the mastoid process. So anteriorly, you'll have the styloid process, and most posteriorly is the mastoid process. So from styloid process to the hyoid bone, you'll have the stylohyoid muscle. So posterior inferiorly, you also have the stylohyoid as well as the posterior belly of the digastric muscle, right? So that's the another boundary. Superiorly, or the base is the base of mandible and a line that joins the angle of mandible to the mastoid. So previously, did we have any other line somewhere? If you can recall here, line adjoining the angle of the mandible to the mastoid. And again, we have that line, which is a basically imaginary line that joins the mastoid to the angle that is there, and also an imaginary line, and then these are the boundaries. When you talk about the roof, and also the base of mandible is superiorly or the base. Okay? Moving forward, roof. Roof of the triangle is formed by the skin, superficial fascia that contains platysma and cervical branch of the facial nerve. So, okay, here there's nothing special because we already know that roof is formed by skin and superficial fascia. Now, superficial fascia has a platysma, right? We already studied that the superficial fascia of the neck, it has platysma, that we already know. And platysma is innervated by the facial nerve as well as the cervical branch of the facial nerve. The cervical branch of the facial nerve. So facial nerve has five branches. So the fifth branch is the cervical branch. So platysma is innervated by the cervical branch of the facial nerve. So we already know that. So it has the skin and superficial fascia. And superficial fascia we already know. We have studied in the cervical fascia that it has your platysma, right? The superficial fascia we're talking about. Ascending branch of the transverse or anterior cutaneous nerve of the neck. It also has that. It also has deep fascia. And what is this deep fascia? Remember, we have an entire video on deep cervical fascia. It splits to enclose two glands, submandibular and salivary gland. Submandibular salivary gland and parotid gland, right? So deep fascia encloses both of them. Now the floor is formed by the mylohyoid muscle anteriorly and by the hyoglossus muscle posteriorly. So anteriorly we have mylohyoid, posteriorly we have hyoglossus. So let's just look at that as well. So see, anteriorly is the mylohyoid. So mylohyoid, right? And posteriorly we'll have the hyoglossus muscle. So hyoglossus and mylohyoid. A small part of the middle constrictor muscle of the pharynx appears in the floor. So even middle constrictor pharynx, a small part of it also appears. So that also, if you want, you can mention. It's not clearly visible here, but